Hey guys, what's going on? So I'm studying for pharm right now, but I'm taking a quick break to do this video. Really, I just need a break to relax. I'm processing all the information, just did a whole lot of reading. But yeah, so I had actually gotten a video request from Boss I-007 over my winter break, and he was basically asking about my medical supplies and where I keep them during clinical. So I figured what I would do is do what's in my clinical bag video and show you guys what I do bring to clinical, as well as the things, the nursing supplies that I have, like my blood pressure cuff, my stethoscope, that kind of thing. And yeah, address his where do I keep them during clinical question. So, okay, first off, my medical supplies, my nursing supplies. Um, so this is my stethoscope. It's clear and silver, nothing too fancy. It's an American Diagnostics, it's a American Diagnostic Corporation stethoscope. You guys can see the box. ADC. And it was actually a gift given to me by one of my close friends. She's like my sister. Her mom gave it to me because she's like, so pro me doing nursing, and she really wants to support me or whatever. I like this stethoscope. It's really good. Like, it hasn't failed me yet. I can definitely hear clearly through it. It has the whole clicky feature. Like, I twist the bell and the diaphragm depending on what I'm listening to. Like, if I'm going to use the diaphragm, I twist it one way, the bell the other way. But yeah, it's really clear, portable. It's not, I don't think it's ugly or anything. I like it. It works. It had interchangeable ear cover things. The last one I had was black and it was softer than these, but the black one's ripped. So note to self, I guess, that this one might rip. The ADC. Does it have a model number on it at all? No model number. It's the Iscope light. So I guess that's what it would be. But yeah, I really like the stethoscope though. I feel like for my first one, this is pretty good. A lot of my classmates they do have the Lippmans. A lot of my classmates do have Lippmans, and I personally feel like I want to upgrade to a Lippman once I've become a nurse. Like, that'll be my whole, you've made it, you're here, you got the professional stethoscope. Like, that's kind of where I want to go with that. So I like this right now. It's been holding me down for this past semester, and it's strong. I know it'll last me until I finish the program. So yeah, that's my stethoscope. My blood pressure cuff is also ADC, and I got it on Amazon for $22. It gets the job done. I mean, not that I've used 100 trillion blood pressure cuffs in my life, because I haven't. But this one, it's for average size arms. So like, if you do have a patient who's obese or overweight, it's not gonna fit over their arm. And only reason I know this is because, like, last semester when I was learning how to take vitals, and I was practicing with all my friends in the dorms and everything, one of my friends, he's really, really muscular. A couple of them actually really muscular, and I could not get the cuff around their arm, so they weren't good candidates for me practicing on. But yeah, but it's not bad. The only other thing I can say I don't like about it is that the placement of the sigmometer meter, this placement is not really convenient when you're wrapping it around the arm and then you want to look at it while you're rotating this and pumping the air into it. It's not really compatible. Like, I would have to take it off. Sometimes I would have to ask them to hold it while I was using it, so it got the job done. I passed taking blood pressure in class last semester, so I learned well off of it. But there are better out there. Which ones are better, I couldn't tell you right now, but I know there are. But it got the job done. And this I actually do not use in clinical. I don't use this because every patient's bed has a manual blood pressure cuff on the wall, and aside from that, they use the automatic ones anyway, so I don't need this. This is for if you're at home and one of your family members is like, can you take my pressure really quickly? Or you just feel like you need to brush up on taking your manual pressures. This will be perfect for that. Okay, so now what do I actually bring to clinical? First of all, this is my clinical bag. Now, I'm a really, like, I have a huge bag fetish. I love bags. I really, really love bags. So, I don't do the whole, like, some people bring book bags to clinical and stuff like this. This one is perfect for me because it fits everything in it and it has enough pockets, and I like the style. Okay. First thing, my folder that has basically all my clinical paperwork in it, and loose sleeve and the different forms we're using for each rotation. I always have my notepad for clinical. This I keep in my pocket. Like my folder I'll keep in my bag while I'm on the shift. Or if I like the start of my shift, I usually just have my notepad. After lunch, when I have to fill in the paperwork on the charts or whatever, then I'll bring this in. Well, bring it out. Yeah. So I have my notepad. I have this drug card that came in my, what is that? My Davis's Drug Guide book. No, I lied. Not my Davis's Drug Guide book. Did it? Yeah, came in my Davis's Drug Guide book. Sorry, I couldn't remember if it was that or the Hankies. This is my drug guide. And it's really cool because it just has a quick breakdown of the medication equivalent, so conversions and formulas for solving problems, yeah, proportions, dimensional analysis, all that. So it's really convenient if you know you have to draw up a med, you don't remember a formula really quick offhand, or you forgot what milliliters to, you know, liters was or something like that. So it comes in handy. I always have that with me. Last semester, I used to bring my drug book with me at the beginning. But my professor was really cool. Like, she didn't mind us using the computer or using our phones to look drugs up. And honestly, I felt better looking a drug up on my phone than using the drug guide. It was just quicker for me. Didn't have to flip through as many pages and, you know, the fine print and everything to that extent. It's always good to have one of these, but I use my phone. And on the floor, I haven't been on a floor yet that didn't have a drug book themselves anyway, that they would allow the students to use. So, comes in handy, but yeah. I have my watch always. Yeah, my pretty watch, which is really big. I still need a new one, but for right now, this has been holding me down. It's working out just fine. I'm gonna stick with it. And this I have on my wrist, obviously. It's in my bag. Like, I keep all this stuff in my bag in between clinical days just so I don't lose anything. But, yeah, my watch obviously would be on my wrist. My IDs, I have to have the hospital ID, my school ID, and my CPR certification. All that in my ID holder with the clip thingy, you know, my little clip, and it pulls out, you know, attaches to my uniform. Can't go anywhere without it because they got to be able to identify you. And also, where's my pen? Also my pen. In my pockets, I keep 2 clicky pens. The clicky pens are really good. Like, it's just so much easier than having to pull the cap off of one pen and, you know, put it on the back and write. Sometimes you lose the cap, then you put it back in your pocket. It stains your uniform. Whole bunch of drama. You don't want to deal with it. Get a clicky pen. They're the best. So I usually have 2 clicky pens in my pocket. I keep a pencil in my bag just in case, you know, I lose my pens or anything, or I do need to make a calculation. Time to go. Well, I have my Time to Go pen. I think I threw this in last week, actually, just in case I did get a stain on my uniform. So, I'm going to keep it in my bag anyway, because I don't really use that. That'll probably, to clean my uniform, probably be the only thing I really use it for. Oh, my coffee mug. Every morning I have coffee or tea when I go to clinical. Whichever one. Like, I don't know. Whatever I feel for that morning. In my bag, I usually also have a bottle of ginger ale, a bottle of water, and I try to have yogurt in the morning before I get on the floor. Sometimes I bring my lunch. Most times. Like last semester, I brought my lunch every single week. Like I didn't, buy hospital food or anything. This semester, I kind of don't know what I'm going to do yet. I don't know if I'm going to do the lunch every week thing or... Because I'm on campus. It's not like I'm cooking my food all the time. Like I had frozen stuff. But the frozen stuff, when you get there, just a whole bunch of complications. So I don't know. I'm going to see. I always have Blistex and lip gloss. Gotta make sure my lips aren't dry. I usually also have mints on me or gum. I don't chew the gum around the patients. Like, I'll chew it in the morning before I get on the floor and spit it out before I go into the patient's room or whatever, just to make sure my breath is fresh, Headphones for when I'm on my way to and from clinical. I always listen to my music or I'm watching YouTube videos or something to that extent. And, oh, lotion. Yes. Always got hand lotion on me. The lotion serves many purposes. I mean, you're always washing your hand on the floor anyway because hand hygiene is, the #1 way of protecting yourself from germs and the patient. But also, let's say you're on a Jerry floor or a med-surg floor and, you have to clean somebody up after they've just had a bowel movement. Get some lotion, and a lot of nurses on here have said this, on YouTube have said this, dab some under your nose or something, and you don't even smell the movement. Well, you don't smell it as much anyway. That's what I'll say. That's been my experience. So it serves many purposes, but aside from making sure my hands are moisturized and not dry and cracking, they help with the whole odor elimination thing. And as for where I keep my stuff when I go to clinical, Mark, okay, so last semester, they, in the nurses lounge, they would let us just keep our stuff on the chair. So we'd all kind of pile our things into a corner on the lounge chair that they had in there. This semester, it's even more complicated because they don't have a lounge chair. Like, they have a bunch of lockers in there for the nurses, but, they have, like, a coat rack that's really small, and honestly it doesn't even fit the nurses stuff on it. So I kind of try to fold my coat up and just shove it up there somewhere, and my bag I try to keep on, they have one chair in there, so I'll try to keep my bag on that chair. Sometimes I'll come back and they moved it onto the countertop or whatever the case is, but it's one of those things where you kind of stash it wherever you can fit it, honestly. I have my wallet when I go to clinical. I think that's about it. Yeah. That's about it. I don't carry a whole lot. I mean, I know some people probably carry their textbooks and stuff like that. As of now, up till now, I haven't found a need for it yet. Because anything I really needed to look up, it was on the computer. Or I could use my phone, So, less books. That's about it. So, hope this video was interesting, helpful. If you guys do have any questions, you can always hit me up. Thank you so much for the request, Mark. And have a great night, guys.